Let's turn now to a national crisis of a different sort. A recent CDC survey finds that nearly 3 in 5 teen girls say they have felt persistent sadness or hopelessness. That's the highest rate in a decade. And 30% said they have seriously considered dying by suicide, a percentage that's risen by nearly 60% over the past 10 years. Our next guest says social media may play a factor in higher depression rates among kids and teens. And joining us now, Professor of Psychology at San Diego State University, Dr. Jean Twenge. Doctor, thank you so much for being with us. Twenge, I'm sorry. Thank you so much for being with us this morning. You're the author of the book Generations, The Real Differences Between Gen Z, Millennials, Gen X, Boomers, and Silence, and what they mean for America's future. But right now, this survey, of course, focused so much on younger Americans grappling with sadness, with depression. Tell us what you found as the role that social media may play.
Yeah, so I've been doing this work on generational differences for a long time. I get used to seeing changes that were big, but they take a decade or two to get there. But then all of a sudden around 2012, these indicators of teen mental health like depression and anxiety and self-harm and suicidal thoughts started to rise, and they rose really quickly over a short period of time. So between 2011 and 2019, teen depression doubled. So this is a problem that has been going on for at least 10 years, long before the pandemic. But what it does coincide with is the rise of smartphones and especially social media among teens.
So a recent New York Times op-ed that has the title, "What Our Toxic Culture Does to the Young," cites your book, Doctor. Columnist David Brooks writes this: "The members of Gen Z are now practicing the slow life strategy with a vengeance. They have already transformed adolescence. As high school seniors, they are less likely to do the things associated with adulthood and independence, like drinking alcohol, working for pay, or having sex. Gen Zers grew up with hyper-cautious parenting that exaggerates the dangers in life. They grew up in a media culture that generates ratings and clicks by generating division and anger. They grew up in a political culture that magnifies a sense of menace, that presumes that other people are toxic in order to tell simplistic us-them stories and mobilize people's fears. People who grow up in this culture of distrust are bound to adopt self-protective codes of behavior. They are bound to be pessimistic about life and are also less likely to believe they can control their own destinies." So, Doctor, what can be done about this? That's certainly laying out the construct there of the, perhaps well-meaning but overly protective parents creating this culture of fear. How worried are you?
Well, I'm really concerned about the mental health impacts of technology. So in terms of what can we do, we could raise the minimum age for social media to 16 and actually verify age. We could require parental permission to open a social media account, because we know that the more hours a day a teen spends on social media, the more likely it is he or she is going to be depressed. And that impact is the strongest at the youngest ages. Some of these other trends are not as negative. They have trade-offs. Most parents are thrilled that high school students are not as likely to have sex or drink alcohol, but it also means they're less likely to go out with their friends. They're less likely to have a driver's license. They're less likely to have a job. So they're doing these adult activities later, and that's not all good or all bad. But it does mean that when they graduate from high school, they have less experience with independence. And that can also have an impact on mental health, especially when they have to make these decisions and try to be independent when they just don't have as much experience with that.
Doctor, this is Jen Psaki. My daughter is almost 8, and like many parents with kids that age, I wonder, what should we be doing when our kids are not yet teenagers, but they are starting to be exposed to social media through a range of ways? Is there a recommendation? When should they get a phone? What should they have access to on the phone? These are the kinds of things that I discuss with my friends all the time. So I'd love to know what your thoughts are.
Sure. So I have 3 kids myself, and they're 16, 13, and 11. So my first suggestion is put off getting a smartphone for your kid for as long as you possibly can. And then if they do need a phone for taking the bus or for something else, get them an old-fashioned flip phone or get them a pared-down smartphone like a Gab phone. So that our 13-year-old has one of those. You can call and text and take pictures, and that's it. So there's no ability to play games, or more importantly, no ability to be able to download a social media app, because it's a problem. You don't need parental permission. Kids can download it and spend a ton of time on it, sometimes without their parents even knowing. And then my other big suggestion is for everybody, no devices, no phones, no tablets in the bedroom overnight, because we know from tons of research that people do not sleep as well if their devices are right there. And if you say, I need it there because it's my alarm clock, I have some advice for you. Buy an alarm clock.
Buy an alarm clock. And I'll note that my 11-year-old son has one of those Gab phones, a dumb phone, if you will,
Right.
and I cannot recommend it strongly enough. Professor of Psychology at San Diego State University, Dr. Jean Twenge, thank you so much for joining us this morning. Really important work.